Hi, I'm Tricia Bruno, Epilepsy and Research Nurse Coordinator for the Pediatric Epilepsy Program at Massachusetts General Hospital. Welcome to the Sunflower Syndrome Family Symposium 2021. Today, I'm going to be speaking to you about the benefits of epilepsy service dogs. The United States Census Bureau in 2017 reported that roughly 49% of all U.S. households have a companion animal. The Veterinary Association translates this roughly to about 77 million dogs in homes nationwide. It's a lot of dogs. No wonder we love our dogs. Dogs bring us joy. We love their warm hearts, their wet noses. They provide us loyalty, companionship, unconditional love. They provide us comfort. We know many kids and adults alike do talk to their dogs. They listen and they don't tell our secrets. And it is true, we consider dogs to be man's best friend. Science tells us that petting, hugging, and playing with a dog can release and increase hormone levels that are associated with joy and mood elevation. These are serotonin, oxytocin, and dopamine. The human-dog bond has many benefits. Dogs can exert calming effects upon us. They can help relieve our stress and anxiety. They can help increase our socialization and engagement with others. Often walking down the street, you're stopped by someone with your dog who wants to pet your dog, just wants to talk to you, engage in good conversation. Dogs also provide companionship, comfort again, and unconditional love. They help decrease loneliness and boredom and even depression. They can build our self-esteem. They can increase our confidence levels. I've watched many kids try to teach dogs new tricks. And when that happens and the kids are successful, it's very rewarding. It's rewarding for us as well as for them when the dogs respond to them. Dogs encourage health fitness. It's no surprise that science has reported decreased blood pressure and improved cardiovascular health from those who have dogs, who get out there and exercise and hike with their dogs. So service animals, as defined by the American with Disabilities Act, is specifically defined as a dog that is individually trained to do work and perform tasks for an individual with a disability. Among the work and tasks defined by the ADA includes guiding people who are blind, alerting people who are deaf, pulling a wheelchair, and specifically they note alerting and protecting a person who is having a seizure, as well as calming a person with post-traumatic stress disorder during an anxiety attack. Under Title II, which regulates state and local government services, and Title III, which regulates public accommodations and commercial facilities, ADA service animals are permitted to accompany people with disabilities in all areas where members of the public are generally allowed to go. This contrasts to dogs who are considered to be comfort or emotional support animals, because these dogs are not specifically recognized by the ADA as a service dog. Therefore, they're not granted all the rights of a service dog. Dogs in general are pretty smart. They can understand somewhere between 150 to 200 human words, and there are reports of those who can even respond up to 1,000 words. Dogs have the ability to interpret our human emotions. They have the ability to bond with us and provide loyalty. So some other characteristics that are required for a service dog include intelligence, as we described above. Their demeanor needs to be gentle and calm. They need to be trustworthy and loyal in their breed. They need to have the ability to be alert, but also with the ability to remain calm in situations. They need to be adaptable. Their size typically is somewhere between medium and large stance in order to support their owner's size during a seizure. Typical breeds that exhibit the above traits include golden retrievers, Labrador retrievers, poodles, German shepherds, border collies, and now, of course, we have golden doodles and labradoodles who fall into that category as well. So seizure assistance dogs can be trained to perform many tasks during a seizure. They can stand guard over the person during the seizure. They can urge a person to the ground at the beginning of a seizure in order to prevent a fall and injury. They can summon help. They can run to find another person, or they can bark to alert another person to assist. They can be taught to activate a pre-programmed alarm button for help. They can fetch a phone. They can fetch emergency medicine. They can lay across a person's chest or legs to prevent the person from standing up while they're disoriented related to the seizure. They can pull potentially dangerous objects away from the person to avoid injury. They can remove pillows or blankets away from a person's face if a seizure occurs in bed to allow for maximal breathing. They can carry cards with information about the person's medical condition and instructions on their care. It's a lot of work for a dog, so we know that professional training is usually employed. It typically takes somewhere between 18 to 24 months. With regard to sunflower syndrome and seizure assistance dogs, dogs can be taught to interrupt the hand-waving episodes that are characteristic of sunflower syndrome. They do this by putting their nose or paw over the waving arm in order to stop the activity. We'd like to prevent prolonged repetitive hand-waving episodes because on occasion, these episodes can lead to prolonged staring or convulsive types of seizures. We also know that prolonged hand waving can sometimes cause a person to become disoriented and to lose their balance or stumble and fall. Service dogs can be trained for various bracing maneuvers in order to prevent these falls. Some dogs are noted to alert ahead of time before a seizure occurs. This has been reported to occur sometimes, immediately before the seizure and sometimes even up to 45 minutes before a seizure occurs. They seem to have some innate ability to anticipate and warn their owner. They provide safety in allowing the person to lay down or sit down in order to get them to a safe area. Warning behavior that the dogs may exhibit include pacing and circling, barking urgently, or maybe nudging or pawing the owner. And the owner really needs to cue into these signs in order to understand that perhaps a seizure is impending. There's some theories why dogs do alert before a seizure. Some people describe that dogs can detect subtle changes in human behavior and body language that occurs prior to a seizure. Others feel that a person may give off a chemical scent either during or before a seizure, which can only be detected by dogs who have an incredibly heightened sense of smell. The dog may then learn to associate the smell with a seizure. There's a fun fact. Dogs have approximately 220 million olfactory receptors compared to our 5 million in humans. One study concluded that the result of the strong owner bond with the dog, which develops over time, combined with the presence of some pre-seizure symptoms, is the reason that seizure dogs are able to alert ahead of time. So with regards to the positive impacts on quality of life with the seizure dog, we know that they can decrease stress and anxiety. This can be both felt by both the parent and the child from the unpredictable nature of the seizures. Many children who have nighttime seizures, the parents will want to sleep with the child in the room, and having a dog who can alert often provides a sense of relaxation and allows for better sleep for both parent and child. Seizures can actually decrease when there's less stress and people feel more comfortable because the dog is present. We can see increased empowerment, encouragement for those with epilepsy to participate in more social activities that they might have avoided, just giving them some courage and feeling safe with the dog available, which again then leads to increased independence and autonomy. We definitely see increased self-esteem and self-confidence. Some kids with epilepsy certainly feel isolated and certainly can be bullied. Service dogs often help break the ice and provide a bonding experience with their peers. Often kids will come over to other children who have dogs and engage in conversation and, start to form friendships in that manner. Dogs can also increase motivation for the person with epilepsy. Service dogs can certainly attend therapy sessions like physical therapy, occupational, even counseling sessions, and help support, enhance, and encourage the child's participation. They can foster responsibility and empathy, as the dog also relies on its human partner, and also provide companionship, joy, comfort, and unconditional love, as we also see in just our companion pets. Thank you. And here's a few epilepsy service dog organizations that I've just outlined for you. Canine Companions for Independence is one that helps find locations across the country in your area. The others work with people nationwide. And Canines for Kids is a free service that helps connect families with service dogs. They also can help provide scholarships to help defray costs. And here's just a shout out to our companion dogs of the MGH Pediatric Epilepsy Program, who provide us certainly joy, love, loyalty, and much happiness. Thank you.